So we want to celebrate an absolutely incredible year that we just finished. And one of those things that leads us to that best ranking in the country and those other results that we have is really our focus on our lanes and our goals. And so we're very happy to announce the focus for this year and how it ties into our overall strategic framework. So as a refresher, this is our house, our strategic framework of how we are steering the organization and where we want to go. And I always start reading this from the base up, and it starts with our culture. It's our bedrock. It's who we want to be. And I really like that we've really focused on what this means, which is that everyone feels cared for and belonging. And so it's the idea that we build a system where each one of us finds what we want to and feels like they're part of the overall UC San Diego Health family. On top of that culture, we add our needs. And that first one is really that financial foundation. How do we build a model as a self-sustained entity that we have the finances and the ability to do what we want to do? How do we build the new Hillcrest? How do we grow La Jolla? How do we continue to bring care to the community? How do we update our operating rooms? How do we recruit the next great faculty member to our teams? It's about building a financial stability that allows us to do that. Based on that bedrock of our culture and the foundation that is our finances, we really get into our lanes of how we are growing across each year in the enterprise. And we look to deliver excellent experiences, achieve high reliability, which really means building the structures and the teams and the network to really make sure that we do everything to the best of our ability every time, and we provide our teams with the ability to achieve what they need to do. And then lastly, that we grow. How do we ensure that we continue to provide a care network that stretches all the way from the East County up to the top part of San Diego County and beyond, into California, the West, and the rest of the United States? And based on that structure of culture, finances, our excellence and growth pillars, we really become who we are, which is that really group of doctors and leaders who are innovating to develop the care of the future, whether that's the residents and teaching programs in our school, whether that is the research that our faculty does, whether it's the clinical trials, or whether it's bringing cutting edge clinical care out to the community of San Diego. That's why we are who we are. It requires all of these steps to build up to that ultimate pillar of really innovating and supporting that mission of being an academic medical center. So it's that vision that we always look into. How do we develop our goals each year? Because this is not a one-year snapshot. This is our strategic framework of what we are driving to be. And we update it each year, but at the end of the day, this is what we want to be as the essence of UC San Diego Health. So with that, we begin to develop our goals. So for this year, we again have developed our lanes, but we've broken one of our lanes out into two, and that's our people lane. So we have our traditional quality lane, which is really about advancing our journey to high reliability. We have our service lane, which is improving our patient experience across everything that we do. We have our access lane, which is really making sure that this incredible world-class care that we can provide to as many people in San Diego and beyond as we can. And now we have these two lanes that we break out for our people: health equity and belonging. And this is a key difference, because health equity is really about the patients that we treat. How do we ensure that the care at UC San Diego is brought in an equitable and fair manner to everybody? How do we make sure that we play our parts in building the framework for this community to ensure that everybody has equal and understandable and fair and transparent access to care? And this is something that we've always been about, but we're very excited to call this out as our future. We really want to understand, how do we build these actionable frameworks so that we can bring equitable patient care? Now, this is different than our JEDI work, where we look at our justice and our equity and our diversity and our inclusion work. That's really about our people, and that belongs in the belonging lane. So where health equity is talking about us and how we treat the community, belonging is about each other. Again, our goal is to make a community where everybody belongs. And to do that, we need to have the ability to work on JEDI, to make a commitment to a culture that feels safe to speak up. And that's about our belonging lane. How do we treat each other? And how do we make sure we put the systems and tools in place that everybody feels they have a voice and their voice can be heard? And our last lane is our efficiency lane. And this again goes to that framework of our whole house, which is how do we maintain and strengthen the investment in our future? How do we build that financial goal to who we are? So for our lanes this year, we're happy to announce our metrics that will be measuring our work on these goals. In quality, we will continue to track against the Vizient Q&A award. This is something that we've actually been a leader in the UC system. This with a huge shout out to Dr. Longhurst, Chad Vandenberg, the entire quality team, all our faculty. By using this measurement, this has helped drive us to that top ranking in US News and World Report. And the other UCs are now using this metric as well. So we've been leading in this one. It's working really well for us. And again, we want to achieve that high ranking. For service, similarly, we want to continue to drive many units meeting or improving in that likelihood to recommend score. So if you're already at that point of 90 or above, fantastic, we get a point. If you're not, it's about growing. And we've hit this 2 or 3 years in a row. We did fantastic on this year, and we want to continue growing there. We're reaching the goal a little higher. And importantly, again, this is our CSIP goal. So this is a goal that goes for the entire institution, that everybody gets a result from this goal. In access, last year we had 2 goals. We're going back to 1, where we've been focusing a lot on growth in the outpatient. This year, we really want to focus on the inpatient as well, and to make access, to make more beds for our EDIPs, for our ED patients, for our surgical patients, everything that we need to do. And to do that, one main thing we can go after is our unplanned readmissions. How do we make sure that we provide the right care so our patients stay out of the hospital after we treat them, so we can save that bed for another individual? Now we get into our 2 people goal, again, health equity, which is looking outside the institution. This is really about an education moment for directors and us leaders, to complete 2 sessions on this so we can learn and build our own health equity understanding and footprint, and then develop and really have a plan of where we're going with this. Since we are in our infancy in this work, we've been doing it, but this is our coordinated effort to really bring it out of UC San Diego Health into our community. We've got to start with the bedrocks of teaching and then building. And we look forward to getting that done with a measurement of how many people we're able to do with education and build that plan. On belonging, to build that culture, we really want to focus on the safe to speak question, which came from our most recent employee survey. So remember, that's an important goal, which basically is asking, do our teammates feel that they can speak up and that they have the ability to be heard? And so we'll be looking at completing a lot of the work from the toolkits that come from that survey that we did, and really making sure that we build them and measure them as we move forward. And this is really about all of us. This will be key work as we build the future and make sure that our people feel that they have that culture of safety that matches the safety we know we have with US News and World Report, but how do we make sure each one of us feels that safe level? And lastly, efficiency. Again, this is the bedrock of finance. Last year we had a day's cash on hand. We'll be focusing this year on margin. And this is really key. Our future has to come with this work. And you'll hear a lot more about our OEC work that we're doing, and we're really putting a lot of focus here. The world around us has changed, and we have to change with that. And Michael will be discussing that in a moment. So we're going to now deep dive into a few of these. We're going to break this over 2 weeks. So our 2 sessions of connecting today, we'll be focusing on quality, access, and efficiency. And we'll be tackling our experience and our 2 people lanes in our next session. So the way we'll do each one of these, we're going to look backwards to FY23. How did we do? What did we learn from the work that we did? Focus on what we're doing this year, the ones I just flew. What does it mean to have that goal? And most importantly, what does it mean to you? What does it mean to be a leader in this organization? How can you help us achieve that FY24 goal? So thank you. And as we jump into this, I'm very excited to get into our first goal, which is our quality goal. So I'll turn it over to Chad. Chad?
Thanks, Brendan. Thanks, Margarita, for having me here this afternoon. It's nice to spend time with all of you. I'm going to do, as Brendan just described, sort of reflect back and then also talk about our goal for fiscal year 24. So if you go to the next slide. As we think about the last year, the year that closed in June, we have some good news to report, and Margarita shared some of that, which is our projection right now, as we look at the data through May, is that we will land at number 5 of 116 academic medical centers. Again, a remarkable accomplishment that's not really about that Vizient Q&A Leadership Award. It's really around following the IOM's framework for quality, which you can see in the donut here on the bottom left-hand side, and making sure that these elements of care are our focus. And they are very closely aligned to what our patients ask for us to focus on, that equitable care, that patient-centered care, making sure it's safe and that they're in the right location for just the right amount of time in that delivery of care. So that's why we follow the model of the Vizient Quality and Accountability Scorecard. And last year, we don't have it finalized yet, but we are projecting out that we will be top 10 of all those 116 academic medical centers in our mortality performance, in our experience, our patient-centeredness performance, and in our health equity performance. So that is really remarkable. And again, a big shout out to all of you and the teams you're leading that make that possible. The areas of opportunity, which will sort of segue us into the fiscal year 24 goal, is staying focused on effectiveness. And the big driver there is readmissions. And you heard Brendan mention that our access goal is going to focus on readmissions, and we'll talk more about that in a moment, but it also plays true in our focus on the Vizient Quality and Accountability Scorecard. The other domain is safety. And while we started out strong in July, as Margarita shared, that is fantastic news. We had some ups and downs through the last fiscal year. We will probably end the last sort of period of time relative to the Quality and Accountability Scorecard ranked in the 20s relative to that domain. So it'll be one of those that we continue to march forward in our journey to zero harm. Next slide. So as we think about the goal ahead, and we're going to stay true to that framework. We're going to stay true to that IOM framework, these 6 domains of quality, because they are helping push us on this journey to high reliability. This idea of being a highly reliable learning health system, and the tenets of high reliability that help guide our day in and day out in terms of delivering that exceptional care, forming the structures and processes and support mechanisms to make sure that we're delivering that exceptional care each and every time. So next slide. Here's the goal as sort of written. The idea that we're going to continue with this focus is for 2 reasons. One is, again, it's what matters to our patients. They ask us to make sure that they're safe in our care. They ask us to make sure that we are equitable in that approach and that we're patient-centric in that approach. So this framework really helps us stay true and focused to that. We have adjusted the goal this year to tighten some of the bands associated with performance levels. You'll see it's underlined here at the top of the slide, where we'll say now that our threshold is, in order to meet threshold, we need to be less than 20 or ranked 20 or better. Target will be 11 to 15. And then, of course, the max, which we've been able to hit the last 4 years and are on track for a 5th year, is related to being in that top 10 performance. Keep in mind that all of the other 116 academic medical centers are focused on these or very similar domains. So in order to stay in the top 10, we not only have to continue to improve for the betterment of our patients, but we have to do so at a pace that is faster or further than our peers in that benchmarking platform in Vizient. So in order to do that, there are 3 sort of elements I want to call our attention to help us drive towards that success that I know we will have in this year, in this fiscal year. One is sustain the excellence that is already there, right? Sustain the excellence in terms of our mortality performance and that experience. I think we'll hear more at our next meeting around experience, but we had a really remarkable year, and you are leading that performance. And the idea that we are quarter over quarter, month over month, making improvement in the experience for our patients as reflected back to us by our patients is tremendous. And we need to continue to sustain that work. We do need to focus on harm. This past year, we will probably realize somewhere in the neighborhood of 400 unique incidents of harm. So more than 1 a day across our enterprise. And if we're shooting for this top 10 again and again, we've got to get that number far lower. And so that focus on harm and harm reduction will need to take place over the current year. In order to sustain that sort of top 10 performance and really even push us even higher as we strive for being number 1 for our patients, we need to get that performance for that domain in the top 10. And again, continue to chip away and continue to improve in our readmissions. Our patients want to come in for the exceptional care, but then they want to be discharged and not have to return unexpectedly. Next slide.
What a great reflection that really ties into just kicking us off to take a look back at our experience goal during this past year, and then a look ahead. So just a reflection slash reminder that we have so many of these great patient stories that come in many different venues. One way is that our patients share via the patient feedback surveys directly into the portal the compliments that they want us to share with one another, as well as our team members. And so we will send out, as part of the packet, just a quick guide to show you how to go into the NRC portal and share compliments with your team members. So it's a great way to provide that recognition. It's a great resource for starting your huddles with your teams. And so just pleased to remind you about that. Next slide, please. So wanted to take a minute just to recap. We know that every single day we are leading the way to ensure that everyone feels cared for and everyone belongs. And so one way in which we measure how well we're ensuring our patients feel cared for and belong when they're receiving care is through when we survey them about their likelihood to recommend us. And so this is a look at our organization-wide experience goal. You'll remember that 100% of our team member incentive was related to our performance on this measure. And so we had raised the bar this past year, but continued to do amazing. And so glad to report that we did achieve max with 83%, the highest number of units, 289, improving by 1.5 net promoter score or more, or maintaining that 85 net promoter score or above. So congratulations and deep gratitude for the important work that all of you continue to do to ensure that our patients are having a good experience when they are with us for care. Next slide. So this is just a high level overview. Once we really take a look at what did we learn, a lot of things we could go through, dozens of slides, but high level for you today. Response rates are really strong. So compared to what we had with previous vendors, as well as just the industry standard for response rates, we've got a strong rate between 20 and 30 for inpatient, ambulatory 30 to 40. Those service alerts, you'll remember, those are items that come into the portal, and really we're asking leaders to attend to through natural language processing. The system is flagging that this might be something that needs to be looked at. Oftentimes you'll find that there's no action necessary and we're just asking you to acknowledge it. But in some cases, you can look at this as if a patient is bringing a concern to you right away and it just needs to be addressed. So we're really trying to achieve 90% of all those service alerts being resolved. And so we'll continue to support you. We've got tons of training materials, can meet with you one-on-one to help assist in that. It's also important to point out too, I think sometimes we lose sight that over 85% of the comments that we get, I know sometimes we spend time deep diving and it feels like those negatives are bubbled to the top, but there are over 85% of those comments that are positive. So a really good opportunity to understand what we're doing well. Some focus areas, and you'll see the theme, I think, continued into this upcoming year. We really want to see progress year over year, making some strides, but for hospital, really tending to focus again on cleanliness and quietness, knowing we've had implementations and improvement opportunities that we've collaborated and partnered with departments and teams, and we'll still continue to work on that. And then on the ambulatory side, really looking at how do we communicate when there are delays about appointments, and then that perception of patients and access to care in the timeliness that they are hoping for. So if we would go to the next slide. please. So sharing with you our new goal for FY24. I know we've been to several venues, so just a reminder if you've already seen this. So still looking at that Net Promoter Score of likelihood to recommend and making 2 changes this year. We're increasing the threshold, target, and max. So now it's 1, 2, or 3 Net Promoter Score point increase. Or we're also moving, if you remember, it was 85 Net Promoter Score for maintaining. We're shifting that to 90. But we've analyzed the data. We feel confident. We're consistently challenging ourselves to do better. And so building off that, we've had this goal approved. So making sure we're either moving the bar as far as improving Net Promoter Score or maintaining. And we know that even maintaining is still progress. You have to be able to remain focused on those great things that you're doing to ensure that you're consistent in your experience. Next slide, please. So this is a great look. Our data team is constantly developing new ways to share data so leaders can take a quick look and understand areas of opportunity. And we are frequently asked by site on the inpatient, what are the key areas we should work on? And I know all of this is going to be sent out. We've just color coded some green areas where we've made progress, and then those sort of orange areas are either flat or hoping for improvement in this year to come. Likewise, on the next slide, you'll see ambulatory has a slide where we're really looking at key drivers and opportunities. But when you start to look at all of these questions, the common theme is communication. So we've organized this slide. The top 2 opportunities are across the office team. So providers and that larger team, patient knowing what to do. What do you do if you have more questions after your visit? And then our key question, were you treated respectfully and without bias against race, ethnicity, preferred language, age, gender identity, sexual orientation, or other personal traits? And so we've also put in here our FY23 baselines for you to get a look. And then if you look below those 2, we sort of divided out what are the provider areas of influence, and then what are those office staff domains. So trust, providing enough information, that careful listening, and then on team members in the larger office team, that courteousness and helpfulness, and keeping informed about delays. Next slide. And then this is just a listing of all the measures we're really focused on tracking. And like I said, that will go out with the packet as well. It's pretty much everything I've covered here. On the next slide. So a lot of data, and so that what do you focus on? We kind of said, okay, top 5 things here. If a unit's below 90% on top box on likelihood to recommend, that might be a place to start to really focus there. If you have a question or a domain area that's less than the 80th percentile, especially in that one slide that shows those sort of flat areas or slight declines, that would be a place to take a look. On inpatient, like I mentioned, cleanliness and quietness, and then the EDIP and the ED admits, and then on ambulatory, it's really those communication pieces. And just encouraging you to know and understand your data, spend time with Office of Experience Transformation coaches and data team. We're happy to help you and just have those conversations with your team members as well.
Let's go on to alignment and talk about how we did in fiscal year 23 with our alignment or with our access and growth metrics. So we did really well with growth. We achieved our 6% target, and that was a combination of all of our MRNs and increasing the total number of MRNs by 6%. And to quote our leader, Patty, not that I'm competitive, but I don't really like red. And access, we didn't do nearly as well. We failed to achieve our target of having 50% of our areas have new patients in within 7 days. We didn't achieve that, but let me talk about these things in a little bit more detail. Carla, if we could go to the next slide. You can see that our growth metric is based on new MRNs. And it's a combination of newly created MRNs. These are new patients that came into our system, newly activated MRNs, patients that are in our system, but are just now getting to scheduling their first appointment, and then reactivated MRNs. These are patients that have been in our system for a period of years, but really haven't done anything with us for the last 3 years, and now they're coming back in. And in combination, those three areas grew from around 109,000 to 116,000, or a 6% increase from fiscal year 22 to fiscal year 23. So this is great with the growth metric. If you go to the next slide, but as you can see, as we grow, as we bring more and more patients into the system, it becomes increasingly difficult to see those patients within 7 days. And that was our target for ambulatory access. So you can see in all of the areas we were feeling that stress. We were feeling the pressure of bringing more and more patients into our system and being able to accommodate them on a timely basis. If you go to the next slide, Carlisle, you can see, let me just stop for a sec. I got a message from Oprah. Interestingly, I got these little candies and they had a fortune. They were like fortune candies, like a fortune cookie. And in there was a message from Oprah, and the message said, every failure that you experience in life is really an opportunity to learn and an opportunity to grow. And that's kind of very applicable to what went on with Access. And we started a work group with Access. We focused on those 6 main service lines that were presented in the last slide, and we tried to identify what are the things that we could really do to move the needle with Access. And this slide kind of presents it, but it comes down to 3 basic things. Number one, how do we learn to do more with what we have? And that's all about efficiency, making sure that our session templates are optimized, making sure that we're maximizing the use of our templates. We're getting our providers to kind of use their templates well, make sure that they're well supported with nursing and other staff members. So we get the most out of everything that we have. The second key piece of learning is leveraging our APP staff. Our APPs are awesome. And having them work at the top of their license gives us the ability to expand our access. We have the APPs doing more independent sessions. That frees up more sessions for our physicians, and it also allows more patients to get into the system on a timely manner. So number one, do more with what we have. Number two, leverage our APPs so that we can have them operate at the top of our license, or top of their license, and also create more access that way. And then lastly, make way for new providers. It's the beginning of a new fiscal year. We've got new providers coming into the system in all of the functional areas, and this is going to be a mechanism by which we can accommodate more patients. So we feel really strongly with the combination of getting more out of the things that we have, leveraging our APPs, and optimizing the onboarding of our new clinicians, we are going to be able to solve this access problem. And as we go into fiscal year 24, I'll go back to Chad. Chad will take us through our access goals for fiscal year 24.
Yeah, absolutely. Thank you, MJ. And the access is pivoting a little bit in fiscal year 24, as you can see. We're talking about unplanned readmissions, and you might go, well, what does that have to do with access? Well, it has everything to do with access, because now we're talking about the capability of serving more and more of our community, whether that's in the inpatient setting or the outpatient setting. And it begins to connect the line across that continuum of care. Because today we have about 85 patients who are in a readmitted status, occupying one of our beds. And that's patients who we should work towards caring for in our ambulatory environment. And then we have folks who are in our EDIP status, or they are admitted but holding in the ED. And those are awaiting those beds from the patients who have just been readmitted. along with the great work that Matthew just described in the ambulatory access environment, and the clear key learnings that have come about over the last year, I think we'll be able to solve that continuum of access. So the goal here is really around reducing readmissions by creating both the ambulatory appointment availability for these patients and keeping them out of our hospital. And we're going to target these 0.15, 0.25, and 0.35 absolute sort of reduction in our all-cause unplanned readmissions. If you go to the next slide. Some of the same elements that you saw in the previous slide are depicted here. They came out of a lot of work, including a 3P effort. And these are the pieces of work that, as you can sort of, I like to call this the wheel slide, as you work your way around the wheel. And if you think about, if you start at 12 o'clock where a patient is admitted, all the attributes that help successfully that patient navigate that admission, prepare them appropriately for discharge, transition them quickly into an ambulatory kind of care setting, and then keep them in that ambulatory care setting until some future need arises, and hopefully prevent a future readmission. And so the real emphasis I want to place on this slide is that key transition, because it plays off of what MJ just described to us, which is how do we create availability? And I'll summarize this at the end of our conversation today when we talk about the key learnings, but it's really around creating that access immediately post-discharge for these patients who are most vulnerable to become readmitted. It's secondly, doing goal concordant care. How do we think about the needs and the trajectory of those needs in alignment with our patients? And that really starts in the ambulatory environment long before we ever get a patient admitted. But once they are admitted, how do we do and execute against the goals that they have and the wishes for their care journey? And then lastly, but not least, thinking about this efficiency and all the work and continuing all the great work we're doing on the inpatient side around bed capacity, throughput, maximizing our operations so that we're able to care for more and more members of our community. Those waiting in the emergency department, those who haven't even arrived to the emergency department, and of course, most ideally, keeping people well in the ambulatory environment.
Welcome, everyone. Good afternoon. I'm going to discuss our health equity goals. 4 things that I'm going to talk about is 1, our goal, SEMREC goal for 23-24 fiscal year from a JEDI lane. Talk more broadly about health equity. What is it? I'm going to outline the relationship between health equity and EDI, including clarifying what the JEDI department can do and does not do. And then 4th, I'm going to announce our goals for the fiscal year, including creating a health equity plan for your area. Next slide. So what is health equity? It is a state where everyone has a fair opportunity to be as healthy as possible. What that means is reducing and ultimately eliminating disparities in health and social determinants of health that adversely affect excluded or marginalized groups. Health equity is the justification and motivation for eliminating these health disparities. These health disparities are avoidable. And for example, some of the examples of the social determinants of health is access to jobs, paying a living wage, access to quality education, food, housing, healthcare that could adversely affect historically marginalized excluded groups. Next slide. So, determinants of health equity. So as you can see, this slide represents a political and structural pivot as compared to a social. These shape our opportunities and resources that we need for health. These determinants result from intentional societal decisions that are embedded in our laws, policies, and practices. Political and structural determinants are unfairly disadvantage some individuals and groups while unfairly advantaging others. Some examples include conditions of where we work, conditions of where we were born, where we grow up, how we live, our age. And what drives home for this slide for us, for healthcare, is the language and cultural barriers that we all see on a daily basis. So what we want to do is become proficient in providing resources for these patients. Next slide. So the JEDI Health Equity Symposium is going to be in our FY24 goals. There will be 3 90-minute sessions. The first one is October 18th. I believe everyone got an invite. We encourage that you come in person, but also this is going to be videotaped, and so you can watch it. The goal is to educate and just raise awareness and have a catalyst for action. The topics that will be covered, there's 3. There will be the Health Equity 101 that will be given by Dr. Sine. 2, the Maternal Health Inequities, which will be given by Dr. Meadows. And then the 3rd, the Language Access, will be given by Dr. Ortega, Birmingham, and we will have, he's from Birmingham Women's Hospital in Boston. And then on the right is some suggestions that we have gotten from different people throughout the organization. So what you guys want to see and what we're hearing is mental health, cancer health inequities, immigrant health and asylum seekers, and you want innovative approaches to care for unhoused populations. Next slide. So we want your ideas, okay? So if you have ideas on topics for the symposium, the health equity framework plans, please email hjedi@healthcare.ucsd.edu. Your voice matters, and write them down. Next slide. Okay, the health equity pyramid, I'll go into it a little bit more in depth. So as you can see, this outlines the relationship between diversity and patient outcomes. EDI is pretty much, the left side is focused more on the workforce, whereas the right side, patient outcomes and experience, are where we really, really need to hone in on. And that focuses on our patients and communities. Next slide. So what is the scope of the JEDI team? Well, I'm one of the JEDI masters, and I'm also the nurse manager for the Neuro ICU and Neuro PCU. But what we do is, this is out of the scope. We don't do leading operational initiatives. We don't develop trainings, but what we do is help you to come up with ideas so that you could train your staff. I have the privilege of doing some talks for the ICU, and I did one for another department where I discussed some policies that people were struggling with. I helped them to really go over how it suits their department. But we can help you if you're struggling in your area with a certain DEI or community initiative. We can help. But we do not address personal issues and grievances between team members. We can offer suggestions, we can guide you with those conversations, but we don't address personal issues and grievances. Next slide. So what is in our scope? We advocate for organizational and structural change to integrate equity in all the health system operations. We consult and advise senior executive leaderships on JEDI issues. We coach, is what I was talking about before, and individual service area leaders on strategies to successfully implement these JEDI initiatives. And then we compile all these resources on our Jedi Pulse website. And we educate on Jedi initiatives and healthy equity topics. We will partner with teams and leaders to lend content expertise in the Health Jedi. Next slide. So getting into more of the goal for FY24, we will have health equity planning clinics. Leaders can reserve a 20-minute session with Dr. Sine or one of the members of Jedi team to discuss and plan a focus review, a draft of your health equity framework. The goal is to advise you and assist you in the plan and create a healthy equity framework for your specific area. What is very important is that you do the pre-work. To maximize this session, we would like you to review the health equity resources and then jot them down as you have questions, jot them down, and then come in with these questions that you may have, because someone else may have them too. And then we will meet with you prior to discuss if that's what you want. So again, there will be 3 dates, October 24th, November 2nd, and November 14th. There's a QR code here for you to register. Now, just to make it a clear point that we are not requiring this plan to be implemented unless you already have done it already, then we will help you. The goal is for the leaders to be exposed to health equity, what it is, the framework, critically think and talk about and create a plan for how you can address health equity challenges in your area. These clinics are designed to support you in that planning process. Next slide.
I'm really honored to introduce a new member of our team, and that is Dr. Tanya Hampton. She has joined us to be our new Chief Human Resource Officer, replacing our beloved Janet Camerman, who recently retired. Dr. Hampton comes to us with mountains of experience, over 30 years working in the field, 15 years in healthcare. And if you simply look at her information and what she's done when she was at Hennepin and other areas, she has an incredible background, both in direct and HR, in legal issues. She's a coach. She has worked as a labor relations practitioner. And in the 60 days or so that Dr. Hampton's been with us, it's already been fantastic to get to work with her and really see a new approach and a new drive to really continue to advance our HR systems at UC San Diego Health. So it's really great that she's here. And so I'd like to officially introduce Connecting. Please meet Dr. Hampton. And Tanya, please tell us about yourself and also introduce us to the goal that you'll be focusing on.
Thank you, Brandon, and really want to say thank you to everyone as well for being here and just being a part of Connecting. I am super thrilled to be here at UCSD. I have hailed, so to speak, from Minnesota, and if you listen hard enough, you'll hear the accent. But the fun thing about this is I, have a love and passion for healthcare. And so by accepting the opportunity, I was able to continue my passion, as well as, frankly, as a young girl, I always thought I would live in California. So it's a thrill to be here and have that dream come true. I hailed with my family at that time in a Ford station wagon. So happy to share that story later. But really want to just give you some highlights relative to what you can expect, both from a people kind of focus for UCSD Health, as well as what you can expect from me personally. So if we go into the next slide, I will highlight our belonging goal, of which I am functionally responsible for, along with all of the you and partnership across the leadership team. Very specifically, the goal is ensuring that we have a culture where everyone really feels cared for and belongs. Frankly, this is something that too is a passion for me, and a journey that I stepped into quite a few years ago as shaping different cultures, different environments for other organizations. So I'm thrilled to be a part of that for UCSD. From an outcome metric perspective, we are really looking at Safe to Speak survey, and the measurement there is making sure that we've got a greater than 65% participation completion rate, as well as a greater than 65% Safe to Speak favorability score. And then it breaks down in terms of what is the leadership and employee expectation from a threshold, target, max standpoint. And really, you know, we want to make sure that we have at least the 25% participation of getting offerings training for employees, and then leaders have a little bit of a different spread as you look at the threshold, target, and max. So, you know, 75% 2 offerings needs to be greater than that at the threshold level, greater than 75% with 3 offerings in order to hit target. And then finally, the extra piece here for max is ensuring that there are best practices that leaders are implementing from the toolkit, and we'll be helping leaders to do that along with your input. So what I will end with in terms of what you can expect from me, in addition to, you know, organizationally of what I just went through, is that I really do believe that every little thing is going to be all right. I think about this at both a macro and a micro level. And short story is that, you know, right, I can focus on ensuring that we try to do our best to remain calm in the difficult situations. But when the paperclip doesn't go on the piece of paper appropriately, I know that might seem a little simple, but it's a simple analogy. That's the part that is harder. Or if the technology isn't working, that's the part that's harder for me. So that's where I would say that generally I show up as a very calm person, thinking about how everything can be okay and how can we put the pieces together. The duck is running underneath. But certainly if the smaller thing isn't quite working, how do we quickly fix that so we can get on to what we really need to do for both our employees and our patients?
All right, so we're now going to focus on belonging in terms of where we have been and where we are going. Next slide, please. So this is just a summary of what we came up with from the June 2022 Team Insight Survey. We took the results and we were able to find these core themes based upon the responses to the survey. We had spent time on safe to speak, professional development, well-being and recognition, and change management. Now, what I'm going to do is go through some of the big accomplishments as a result of the survey findings, what we've done thus far, and what we're going to continue to do. And then I will start to spend a little bit more time around the new goal for fiscal year 24. Next slide. All right, so one big accomplishment has been going out into the organization and conducting several interviews, almost 200 interviews, of really getting a better sense in terms of what works, what are some of those best practices that you're already implementing, and what are some challenges and barriers that might be impacting creating the safe to speak environment. And it's really around being able to create an environment where people are able to constructively have different ideas, opinions, suggestions as part of our continuous improvement and opportunities to have conversations in a constructive manner. And how do we do so? So what we did was create a lot of tools and resources to enable discussing survey results, as well as trying to figure out what are those best practices and suggestions for creating that safe to speak environment. And our first blush was to create the Safe to Speak Toolkit for leaders. And we won an award for that in terms of an improvement award for that particular effort. And of course, we didn't win the award alone because it was really a reflection of all of you as leaders and team members giving us your best practices and insights. Next slide, please. Another opportunity to create the Safe to Speak environment was taken on by our transformational healthcare team. And what they have found was there's an idea and opportunity to create another mechanism for voicing ideas and sharing ideas. So they have created this idea for leveraging Kanbans. It's a visual representation of being able to contribute ideas, put them in certain categories. And so if you have information if you're seeking information about how to leverage idea boards, how to leverage the Kanban methodology, they have an entire section on one of their web pages from the Transformational Healthcare team, where you can go through and look at what is a Kanban board, what are these idea boards, and how do we engage team members to have a safe to speak conversation around these terrific ideas. Some folks are very comfortable speaking up on the moment. Others prefer maybe being able to jot something down and submit them through another channel. So we're trying to figure out what are the different modalities that enable this safe to speak environment that addresses people's preferences for how they wish to share their ideas. Next slide, please. Another contribution to supporting our Safe to Speak theme and priority from the June 22 survey has been taken on by the JEDI team. Many of you participated in the fishbowl discussions. As part of those fishbowl discussions, there was an opportunity to capture the ideas through the visual imagery and the graphic representation on the images on the right that really provides a documented version of what was shared in a confidential manner, as well as leveraging those visual images and the graphics to be the documentation of what was discussed. In addition, the JEDI team has reached out and trained over 40 leaders in partnership, working with them to either co-facilitate or train them to facilitate having certain difficult conversations in order to address topics, issues, concerns, or personal feelings related to race and racism. Another resource from the JEDI team that was a development of a video. This is now available on their website. So please check out the concept of BRAVE, the BRAVE framework, which gives us all an opportunity to leverage best practice tools for how to talk about this topic of race and racism as work. So please take advantage of that resource. One thing that's really important is that we're all on this journey together. We're going to discover certain things that we're more comfortable with or less comfortable with, but it's really about how do we support each other as we navigate this and make everyone as comfortable and as competent in having these conversations, and still retaining some humility and being able to recognize when we've made a mistake and to really model the way as leaders so that this is something where we all need to be able to support each other as we navigate these difficult conversations. Next slide, please. Which brings us to professional development. And what you're going to see a lot more of coming forward in the next 3 to 4 weeks are what we describe as these My Learning Paths. And what we're going to be pulling together are curated content of programs, resources that are available through UC system-wide, that are available across multiple departments within UC San Diego Health, as well as campus, and also things that are available through the UC Learning Center and other facilitated services and offerings that might come from transformational healthcare or Office of Experience or HHR and Learning and Organization Effectiveness. The importance is to try to curate that content on those offerings and provide those recommendations and a one-spot ability for you to look through. Here's what's being recommended. Here's where you can find them so that it makes it much easier for you to navigate and search out the content in one single repository, regardless of where those services are being delivered. So look forward to more information about the learning paths, which include everything from lead development, aspiring leaders, people that are new to leadership or new to leadership here at UC San Diego Health, for those of us who lead teams. And it also includes new executives that come on to our organization and what we need to do in terms of better understanding strategically how to lead the organization. We've also identified quite a few refreshers, professional development opportunities, and of course, tried to map as much as possible to all of our My Performance competencies for individual contributors and leaders. Next, please. Another aspect from the survey in 2022 was well-being and recognition. And for those of you who weren't able to take advantage of the last puppies, circulation of puppies, I hear, rumor has it, we're going to be bringing the puppies back. So folks will have a chance to maybe not so much adopt, want to take it home, but at least take a few minutes in our day to get some well-needed and well-recognized time to just recharge our batteries. So what what Leah has been able to provide here is a number of highlights from what's been accomplished thus far, as well as what they're focusing on going forward. So really being able to find what are those unique opportunities, things that you have brought up as what you would like to see more of in terms of programs, services, ways to recognize, ways to support, ways to provide you with information about what resources are available, as well as resources that are currently not available that you would like to see us provide, and really be able to move ahead with fully developing out a true program and program service offerings to enable all of us to again, feel as though we're valued and appreciated, and especially in the area of mental health, well-being, and recognition for us as a contributor to this organization. Next slide, please. Which also attends to all things in terms of, again, mental health and well-being. It's a lot. There's a lot going on, and we're all addressing various aspects of change management. So to address that, we've partnered with the folks from Office of Experience and Transformational Healthcare and Learning and Organization Effectiveness to curate this UC San Diego Health version of a hearts and minds change management model. We're pulling it together into workshops, bite-sized workshops on different components of the model, really to enable all of us to think through and be prepared to lead change, to address how to transition folks through a change, as well as how to possibly better manage folks that are resisting the change. And so you can go to our Learning and Organization Effectiveness website on Pulse and see what are the different workshops that are coming up, how to sign up for them, as well as the various toolkits associated with the steps within the model. And there'll be much more information as we curate more and more in support of this model going forward. So stay tuned for more updates on our website. Which brings me to the next slide. We are leveraging everything that was brought up from the previous insight survey to continue those efforts. So please know that even though it was a part of last year's fiscal year goal, it's really an ongoing goal. So we will continue all of those different initiatives. We will continue to expand upon them, and we'll continue to report out on what's been accomplished, what are works in progress, and invest our time and energies to support what was identified, as well as continue to survey, get your feedback, and find ways to continue to expand and stay current with what's needed now. What are those opportunities going forward? So that's going to be the transition and the ongoing commitment to what were our goals previously. And here's what our goals are currently for fiscal year 24. We're going to build upon the Safe to Speak. And that Safe to Speak theme is really an opportunity for us throughout the organization to leverage those great ideas that were identified for the toolkits. So on the LNOE website, there's multiple places to find it. There are two different toolkits. One is the Safe to Speak toolkit for individual contributors, our team members, and the other is the Safe to Speak toolkit for leaders. They're very, very similar, but they're just looking at various best practices and different resources, courses, materials, different types of activities and action plans specific to the role of a team member versus a leader. But they're all aligned and they're all in support of each other to really create this culture where everyone feels cared for and belongs, and can do so by speaking up amongst their peers, amongst leaders, across different departments. So that's really the goal in order to create that culture and environment. So for the goals specifically, what we're doing is trying to drive out as much as possible the opportunity for everyone in an individual contributor role to go through the toolkit and find one or two of those different offerings that resonate with them. Each one of those offerings in the toolkit has a deep link to UCLC so that folks can just go into the toolkit and then click on one of those offerings. On the back end, we will keep track of how many people have attended those different offerings so that we can be measuring that throughout the next few months to see how we've met that somewhere at a minimum 25% of our total team member individual contributor population. A little bit of a heavier lift, a little bit more of an emphasis on our leaders is to really try to get at least 75% or more of our leaders to complete two of those offerings. Those offerings might be a 15-minute video. It might be a book summary. There's a lot of variation in there that we wanted to make certain that the time commitment wouldn't be too burdensome. At the same time, we want to up it a little bit. And for the target level, it's for 3 offerings. And now many of you might be then zeroing in on that maximum level This is where we want you to implement at least 2 of those different best practice activities that are identified in the toolkit. But please, we do know that many of you have been participating in the magnet survey, the culture of patient safety survey, and there's a number of action plans that you're being held accountable to. It's really about being able to see what you're working towards. Potentially, if those action plans can dovetail, you'll get credit for how that supports various initiatives and action plans for magnet results, as well as the culture of patient safety results that also will dovetail and give you credit for the safe to speak and the belonging goals. And we'll be sending out an attestation form as we get closer to the end of the fiscal year, so you can document what you were able to implement and what were those results, because we want to be able to recognize that and also get a better sense of what worked and share those best practices even for going forward into fiscal year 25.
Hello, everybody. First and foremost, always want to start out with a shout out to all of our clinicians on the front end, on the front lines of taking care of our patients. Your work and effort are truly appreciated by all, and especially as it reflects through the scores that Chad just went through. So thank you. First slide, please. So this year, again, want to talk a little bit about days cash. We do not have the final results for June yet, but it looks like we are going to miss our goal here. And just quickly, we had a really slow start to this fiscal year. We didn't have the volume we typically would see. We had a lot of costs and all the staff to support the patients, but we just didn't have the patients. So a lot of costs without the revenue really started out and really had an adverse effect on our ability to achieve this goal. That said, the second half of the year, we've developed such great momentum that going into the next fiscal year, I have no doubt we're going to be successful with our FY24 goal. So next slide, please. So as we go into next fiscal year, our goal is not going to be days cash, although days cash is still a key measure what we're looking at to measure our financial viability and success. But as an organizational goal, what our goal for next year is going to be an improvement over our modified margin. And what that means is if to meet threshold, we need to improve by 1%. To meet target, we need to improve by 1.5%. And to meet max, we need to improve by 2%. The denominator for that is if I'm just making a number up, if our modified net income is 6%, to meet our threshold, we would have to be at 7%. So it's not a 1% over 6%, but a 1% plus 6%. To meet our target, it's 6% plus 1.5% equals 7.5. And to get to max, it'll be 6% plus 2% equals 8%. So it's on top of the actual margin that we're going to produce. So again, really important that we work to meet that goal. All the efforts we go to meet these goals help us invest, as Brendan said, in our future, in our people, in the capital, rebuilding Hillcrest, all the things we want to do to better serve our patients, expand our portfolio so we can absolutely serve the community a lot better. So again, I think we have great headwind, and I'll talk a little bit about what that headwind is as we go into next fiscal year. But again, I think we have a great opportunity to achieve these goals as we continue to work together on this. Next slide. So the things we are doing to achieve that financial target for FY24 are many of the OEC initiatives we've been going over the last few months. First and foremost, it's always back to the patient, right? How can we improve access to our services? You heard Matthew and Chad just go over that. You know, the more patients we see, the better we serve the community and our fellow men. Secondly, optimize patient flow in our inpatient areas. Talked about that as a key goal, as Chad just mentioned as well. How can we get more patients through the inpatient areas as efficiently as possible, while continuing to maintain that quality. Third, decrease contract labor utilization. This is one of those areas where we're already seeing significant progress in decreasing that utilization. It's just amazing the progress we've seen in the last 6 months. Part of that is exemplified by our open job report, where we're down 200 open positions from January to now, and that's the great work from Doug Levine and Health HHR and his great TA team, as well as the operational leaders out there like you who are doing their best to hire up in a very difficult market. We're replacing that contract labor with career staff where appropriate. Again, we want to maintain our productivity targets to help us, again, meet our efficiency goal. Reducing overtime utilization where appropriate. Always making sure that we use overtime judiciously and appropriately, but making sure if we do have to use it, we do use it. We are going to continue to hold non-mission critical replacement positions for the time being. We're going to also look at decreasing the utilization of purchase service. Another thing we'll be looking at is the price we're paying for that purchase service. So every dollar we save there, again, helps us reinvest back in the institution. The same thing with medical supplies. Look at improving the price we're paying for those medical supplies and being judicious in how we use those medical supplies. So what we've seen in the last 3 months of this fiscal year is nothing short of remarkable, as we've seen contract labor come down, almost $6 million a month in utilization. Contract labor FTEs coming down about 200. Again, it's maintaining our stead, or actually growing our career staff, but maintaining our productivity rates and really hitting those targets the last few months. So I think, again, we have this great momentum going into next fiscal year, and I'm sure we're going to achieve those goals. With that, we'll get into more of the strategy around each initiative next month. But again, I think we're in a very good place to be successful in this space, not only from a net income perspective, but also in increasing days cash. So thank you.
So thinking about our goals and our priorities, one of our other priorities as leaders in this organization has always been basically the bottom line. We have to be good stewards of our resources and make sure that the finances work, because as the old saying goes, no money, no mission. We are a very valuable institution, but at the end of the day, we do have to create our own bottom line to be able to invest in everything about our future. So with that, we are really kicking off a renewed OEC process. And I'm joined today by 3 people who are working on this with me and will be focused on all of our financial priorities this year. And that is Will Ford, who is the Chief of Staff to Patty Mason, Brad Ulay, who is the Senior Director of Supply Chain Services, and Kara Morris, who's the Senior Director of Budget and Financial Services. The 4 of us together are leading these priorities and initiatives, but in reality, all of this work is all of our responsibility. We're simply being the catalyst to make it work. So we wanted today to do a little deeper dive of why and how do we need to face our financial challenges that we have right now. So first, the moment of the why. And we've been talking about this at the last few connectings, but we're facing a very interesting reality today in healthcare. And that is the world that we've experienced post-COVID is very different than the world that we went into COVID with. That is, we've all taken on the inflationary increases of healthcare, whether that's labor costs that we've all needed to get to make sure that our staff are well paid, whether it's the cost of drugs or pharmaceuticals, whether it's just the cost of care overall. Everything that we do is more expensive than it used to be. On top of that, we are facing this moment in time where the system itself is so impacted with patients, it's almost impossible for us to get the normal flow of patients in and out of the door. When Margarita showed you those numbers earlier, you see that sometimes our length of stay gets over 7 days. And that's because we have patients sitting in house that we need to get out. And when you saw Leslie's numbers looking at experience, you saw that we often are lagging in access on the outpatient basis because we can't keep up with the demand. So at the same time our expenses are going up, we're finding that our system and our flow doesn't work as it always does. But the hardest and biggest driver is while all this is happening, our revenue is not going up at the same pace. Despite the incredible efforts of our contracting team and others, we still are not having increases in our revenue from Medicare and Medi-Cal and others that match the cost we're experiencing in our own inflation. As such, our bottom line is becoming more challenged. And this is happening at the exact same time when we actually need to increase our bottom line because we have so many things we need to do. Whether it's the replacement of the Hillcrest Hospital, whether it's building more things here on this campus, whether it's opening new outpatient initiatives to tackle that access issues, bringing more technology to the operating room so people like Dr. Kalesi can do the cases he needs to do. All of that requires our bottom line and our cash. And right now we see ourselves facing a significant 3-year challenge where we have to make changes, tactical and direct changes to who we are in order to facilitate and make the finances we do. So it's our time to be bold. and tackle this, just like we tackled other things such as COVID and growth and all those opportunities, we have to take that same philosophy and that same work to be bold here and make changes. So in our renewed OEC initiatives, we are focusing on 4 lanes. And those are, first and foremost, increasing access to care. We have to continue to work on our capacity, because the single best thing we can do for our patients and our bottom line is it make it easier for patients to get in and out of our system and get in and out of our outpatient programs. This includes everything from ensuring that outlier patients go to those community need areas that they could be better treated. It means working with ED and others to increase our flow of EDIT patients. It's increasing access on the outpatient basis. It's finding ways to make it so that more patients can come through our system. In addition to that, we need to do work to optimize our teams. We need to make sure that we have the right staffing in the right place at the right cost. This means reducing contract labor and focusing on our own teams instead of outside teams. It means making sure that we staff appropriately for the work we have, not the work that might be here. We also need to focus on increasing our value and efficiency. And this is really about streamlining and making sure that our non-labor expenses are the exact right expenses they need to be. We need to look for new ideas and new ways. We need to look to standardize, all while maintaining that high quality patient care. But we need to make sure that everything we do is efficient and priced. And last, we need to make sure we build and complete a structure that is efficient, that is very tactical and direct, and makes the right decisions at the right time with transparency. And this is a lot where your work will come in. This is making sure that we have a process that allows you to get the resources you need, but also brings overall review to make sure we're doing the right resources at the right time. So how are we digging into these lanes? Well, there's a lot of different work that you can see that goes into this. In the access to care, we're looking at outlier management. We're looking at our length of stay. We're looking at technology, different elements that Donna and Dr. Clay and others have already been leading. We want to make sure that we're really enhancing that work, pushing it forward so that we can reduce the length of stay in-house and increase our access. On our teams, we're looking across the board at acuity-based staffing, making sure that we've got the right consistent staffing that we need. And as I mentioned, reducing that contract labor and pulling down so that we have our own employees. On value and efficiency, we're digging into supply chain work. We're looking at programs across the board and ensuring that we're doing the right thing at the right time. And lastly, when we look at our structure, we're digging into things like OEC, which we're talking about today, our RAC, and our performance management. So digging in a little deeper, when we talk about access to care, what are some of the things that we're doing? Well, if you think about where we are, right now on the left, some of the challenges that we face, even though our census is up, and it's up dramatically, our overall inpatient growth is not that much. It was actually only 1% higher. Now, some of that is because inpatients have switched to become outpatients, but a lot of it has been as this length of stay increases and the number of EDIPs increase, there's no other place to go. We can't do more surgeries or take more transfers in because the beds are full. So it's kind of capped our ability to grow, which is one of our major successes that we need to succeed in our financial outcomes. At times, you can see we have a greater length of stay, sometimes 6 times greater in our outlier patients that are with us that need to be somewhere else. We have excess days that are really just days that if we could do anything but that, we could get more patients in. Every excess day is a day a patient can't be in this hospital. We have a lot of initiatives working forward, and this work is really about honing them and targeting them to move them forward. So where do we want to get to? We want to get to a place where we have the right patient in the right place that starts with a discharge date of when they're going to go home, works toward that discharge date, and ensures that we have all the priorities and the work together to increase our overall volume. So we have a lot of great work in this area. This is really about bringing that together and moving forward. One of the first steps that we'll be taking under the leadership of Dr. Longhurst and Dr. Yashar is an outlier committee that will be meeting constantly to see how do we focus on those patients that are here sometimes over 100 days because we can't find placement for them in the community. If we can simply solve for that, we know that we can find and get more patients in the door. When we talk about optimizing our teams, I already mentioned the work on contract labor. The other area we're looking at is starting again to say, do we have the right staffing and the right staffing basis? So Margarita and our senior directors of nursing and everyone are looking across the board to say, do we have the right basis model for staffing? And we've looked at different ways of doing that. Do we do a zero-based budget? Do we look at some of our best performance times? Right now, we're focused on looking at a zero-based budget approach that starts again to say, what is the acuity of our patients? What is the staffing that we need? And can we be consistent across the board to make sure we're doing the same staffing models? Again, the goal here is to ensure that we have the right people at the right place And we want to build it so that things aren't always falling on our nursing teams to do work. We want to make sure that upstream we have the right number of people in transport, the right number of people doing other work, so that our nursing teams can focus on the work they need to do, which is nursing. I mentioned briefly contract labor. This has been one of our largest focuses since COVID. There was a point in time just less than a year ago where we had over 750 contract labor FTEs in-house. That number is 2x where we want it to be. And additionally, that number was because of the COVID demand across the country. The amount per hour that we were paying for those resources was sometimes 2 to 3 times the cost of our own internal staff. Well, the good news, with huge thanks to Lisa Rhodes and Periop and Margarita and all the nursing directors, we've really seen that number come down. We've dropped that number by over 200 to 300 FTEs per month by bringing those in-house and reducing those FTEs. In addition, with work from Brad Oulet and his team, we've also renegotiated our rates and started to bring that contract labor rate down to be much more related to what we should spend and much more closer to our own hourly rate. Those two numbers are bringing a lot of that expense in line, and has really been a huge driver of where we sit so far. But we still have a long way to go. We want to make sure that contract labor is only used at the right amount in the right places, and is the best way for us to flex up and down, but is not something that we have as a replacement for our own teams. So a lot more work coming in those areas we move forward. When we talk about increasing value and efficiency, our focus is in a lot of different areas. One of the areas that we do is really dig into individual programs. So these are ideas that have been floated up by many of you and our own internal areas to find new things that we can do. How should we do something differently? What are some ideas that we can bring forward? And it could be everything from an expense reduction to a revenue improvement. Is there something that we're not billing for? Is there something we could do differently? Is there something we could grow? Each Monday, we meet with a team that goes through these programs and we identify new ones that we look for to say, how can we identify savings? Our ask to you is to please participate in this, help us find new ideas and help drive things forward. In addition, we've been doing a lot of work in supply chain. So Brad and his team have been working on the per unit portion of this work, digging in with vendors, with our physicians, to find means to say, how can we become consistent and how can we find new ways to buy items? The important piece here is this is not just Brad's team's work. This is all of our work. We need to look at things from reducing waste to finding other areas and identifying areas for us to find savings and find opportunity. And I need to point out there are 2 types of cost in this area. The first is the actual cost of the unit, what it costs to buy a supply or an implant or a drug. And then the second cost is how many of those do we use? In the first area, Brad's team and all of us are working together to find that consistency and that pricing to bring that cost per unit down. In that second area, when we talk about the utilization, we need to partner with our faculty and our physicians to say, how do we do this right so we have consistency in buying, we're not using different pieces that we don't need to do, and how do we do this together to drive that price down? And that's something Lisa Rhodes and Brad and others and I will be leading as we move forward to find new ways and new savings in our progress. So last and most importantly for us is enhancing our structure. In order to do all this work, we have an immediate need. And that is we have to continue to bend our cost curve now so that a lot of the work that we're doing in program enhancements and enhancing our staff can take root and find those savings that we need over multiple years. To do that, we need to start with something that's very direct and very targeted. And that is working through RAC to identify positions that either can be held or can be changed in the immediate time frame so that we can save those positions and invest that money elsewhere. This is the single most important thing as a leader that we can do to basically change the cost curve without doing more extreme measures in our staffing. With that, we've got some major changes that are happening with RAC. First and foremost, on the left, RAC is not going to be just looking at labor anymore. In addition, it'll be looking at things like emergency capital, ensuring that we have the right things and when we need to do it. And anything that is greater than 50,000 will be going to RAC and being reviewed. We'll also be looking at purchase services. All new purchase services agreements that are over $10,000, we'll be looking at those to make sure that we're doing the right thing. We'll also be doing a quarterly review of renewals to make sure that we have the right things and that we're doing the right things that we need to look at. On the staffing side, we're going to ask you to work with us to ensure that we are replacing the mission critical positions. That means if a position becomes vacant in your area, we ask that before you ask to replace, make sure it is mission critical to this moment. And you can see that definition on the right side. A mission critical position is something that's directly involved in patient care. It supports clinical areas. It supports revenue cycle or scheduling. It's required for patient safety or regulatory compliance. These are positions that we have to do the daily work that we do. If we look at that position and say it's really important, but we could hold that position, we're going to ask you to do that in order to find a way to generate some savings at the beginning of this year so that we can implement those other savings that we need to do. So as you come forward to RAC, if you have a position, you need to make sure that it meets one of these mission critical positions before it's brought forward. And then you may be asked questions about how does it meet those pieces as we move forward, because we want to make sure at this moment we're replacing the right positions. In addition, any management or position that becomes vacant or wants to be posted must meet one of those mission critical positions. And we need to have an org chart when you come to RAC so that you can see it. So this is a difficult ask. This is something where we're asking you to help us look at our staffing, look at the positions that we have, and as they become open, do we need that position, and do we need that position right now? Is it mission critical to what we do? If we can continue to hold positions each month, that will generate the savings we need now so that we don't have to make more dramatic changes in the future. The other major element that we want to work on is our performance management. So we're enhancing our performance management process so that we really are looking to make sure that we are meeting our budget and our targeted goals. And when we are missing, we have a means and a direction to try to fix them. Our goal is to really make ourselves accountable to delivering the budgets that we put forth and ensure that you all have the support you need to be successful. So what is going to happen? We are going to be holding bi-monthly performance management meetings where we'll be looking into areas that are unfavorable to either budget or target as defined on the right side. If it's 2 or more FTEs unfavorable, if it's not achieving its variances it needs in overtime or contract labor, or if it's 10% or 10,000 more off in non-labor, we'll be working with the leader in that area, the CAO, the senior director, and the manager of that area to come to one of our biannual performance management, bi-monthly, meetings to dig into what's happening. How can we help and look into that number? What can we do to mitigate and fix that process? We have to at least meet our budget this year in order to improve and make all the other changes that we need to make. So what's our ask to you? If you are running a FINU or a budget that is not in variance, be prepared to join us in this process. You're going to have a lot of help from our finance team and other operators to put together a variance mitigation plan. But most importantly, we need your brain. We had a budget. We thought that budget would be sufficient for the work we need to do. And if it's not being met by what actually happens, we need to come up with a plan to fix that. So that'll be going into place starting in October, and we look forward to enhancing that process with you and making that work. We're going to bring all this through our OEC system, which meets twice monthly, which is a bigger meeting that looks at all of these initiatives together and tracks where we go to make sure that we're saving the funds that we need to save. We put together draft reports that will bring all these numbers through. Are we meeting? What's our targets? How are we doing on the various initiatives? And this would be a key element for us to make sure that we are driving toward that financial goal that we need to meet. In the end, what are we asking of you? First and foremost, we want you to help us develop standard work. We don't want to run, we're a very large institution. We're over a $3 billion revenue institution. We have over 1,000 physicians. We have over 10,000 teammates. Even though we're big, we've got to find a way to manage ourselves that's consistent and looks for high reliability. That means that we don't do it differently in every single area. We look for those best practices. We develop those algorithms and we find standard work so that it becomes consistent and it can really hone in on what we need to do. We're also asking you to help us find and reduce supply costs. We really need your clinical expertise and all your support to standardize what we do where appropriate. We need you to work with our faculty and our physician colleagues to make sure we're doing the right thing. We're not wasting, but we're always bringing the right supply to the right place. We need to champion and partner with those leading patient flow to make sure that we are doing the expansion we need to do. And we need to make sure that everything that we invested in, whether it's a clinic, whether it's a peri-op minute, whether it's a bed in the hospital, that we're maximizing the ability to bring patients through that, because that's what San Diego needs from us. And that's also the best thing we can do for the bottom line. And last but not least, we want you to participate in this work with us. The most important thing is This is not change that's being made to you. That's change that's being done with you. We have to partner on this together to make the bottom line of the institution work. All of us are leaders in this institution. We need to lead ourselves through this process, through these next years to deliver this bottom line. And it should not be something that we're standing on the sidelines and let someone else do to us. Participate in performance management, understand the rules around RAC, understand the dollars and the expense and the flow in your areas so that you can help us identify what is the best place and the best use of our resources so we can maximize our clinical care. So it's a tall task. It's time for us to be bold and drive this work. But we've all seen what we did during COVID. We've all seen what it took to build this from a very small health system into the system it is today. And we've all seen what the future can be when we build the new Hillcrest Outpatient Pavilion, the new Hillcrest Hospital, the new development here. All of those things are within our reach, but only if we continue to do the work we need to do today and build the resources that we have. So I thank you for your time on that. There'll be a lot more coming to you with this, but we need all of your attention and your direction as we move forward.